Hi everyone, my name is Tanner Milliken and I'm a group with Kennedy and Jacob, and we did our presentation over peripheral neuropathy. Peripheral neuropathy is the damage to the nerves outside of the brain and the spinal cord, which will be your peripheral nerves obviously. Some causes of peripheral neuropathy. It's not just like a regular disease, it's not caused by a single disease. Health conditions are what cause it. And a cause of peripheral neuropathy are autoimmune disorders, diabetes, infections, inherited disorders, tumors, bone marrow disorders, and other diseases such as kidney disease and liver disease. Back to diabetes, over half of people with diabetes end up developing neuropathy. The infections can be viral or bacterial. Cancerous and non-cancerous growths can occur on the nerves or press at the nerves. And then abnormal proteins in the blood form or bone cancer is the bone marrow disorders. And then other neuropathy causes are alcoholism, exposure to poison, certain medications, trauma to the nerves, and vitamin deficiencies. A lack of nutrition and lack of vitamins in your diet will kind of cause this. So B vitamins and E vitamins are really important to the nerves. Chemotherapy is another huge thing that can cause a problem with neuropathy, and then just severe injuries that can cause nerve damage. Next are some symptoms. Some symptoms include gradual onset of numbness, pins and needles, sharp and throbbing pain, sensitive to touch, muscle weakness, and paralysis. Paralysis really only occurs in the more severe cases, and it only occurs in the motor nerves. If the autonomic nerves are affected, you'll have heat intolerance, sweating abnormalities, digestive problems, and change in blood pressure. The sweating abnormalities include either excessive sweating or you're not sweating at all. And then the changes in blood pressure can cause dizziness and lightheadedness. So we're going to move on to the diagnosis now. You can either have, first we're going to start out with the medical history, which will include the symptoms, lifestyle choices, exposure to toxins, and your family history. Then we're going to move on to a neurological exam with your relative, which will include the reflexes of the tendons, their sensations, posture, and coordination. And then we'll move on to some lab tests, which will include blood tests, imaging tests, and an EMG. The blood test will detect like vitamin deficiencies, and it will kind of show us what other causes are happening with the neuropathy. The imaging test will be either a CT or an MRI scan, which will help us see the hereditary disc and the tumors. And then the EMG, which is showed in the picture, will show us or test the nerve functions and detect any nerve damage. And then we will do a biopsy on the nerves in the skin. Some treatments, there's 3 types of treatments: medication, therapy, and then surgery. The medications are pain relievers, anti-seizure medications, topical treatments, and antidepressants. These will basically just help relieve some of the pain in the area. Then therapy includes the TENS and physical therapy. TENS is when they use electrodes and kind of stimulate the nerves in that area, and we all know what physical therapy is. And then surgery and procedures will include either removing the tumors that are really pressing on the nerves and causing the problems, or a plasma exchange, which will help with the inflammatory conditions. Prognosis and follow-up. Prognosis kind of varies between the peripheral neuropathy, and it depends on the underlying cause that we have, and it depends on which nerves are also damaged. In some cases it can be permanent, but in other cases it can be treated. Follow-up, we're going to have frequent visits, and we'll have to do physical examinations and tests on like the hands and feet, because those are where it is most prominent. We use the Mayo Clinic to find all of our sources, so if you have any other questions, just visit there or ask me, I guess. Thank you.